Now we're going to look at some values that actually matter. And anytime you look at CR, they are talking about what? Computed radiography. Anytime you look at DR, they are looking at digital radiography. So we're trying to actually look at exposure indicators and other digital exposures. Okay, their value estimate. Okay, so in digital radiography, okay, we're talking about the computed one, okay, or the digital one. So exposure indicators or digital exposure value estimates, they are very essential because digital systems don't give the same visual cues of overexposure or underexposure that films do. You understand? So instead, they provide numerical feedback about how much radiation reached the dictator. So what are the key points about the exposure indicators? They do not measure the patient dose directly. They just reflect what got to the dictator. Okay. So each manufacturer uses a different scale, and radiographers must know the target range for any specific, system, and also the type of imaging they want. Okay, so common systems and their indicators. For example, we have the Fuji computed radiography. Okay, so S value is inversely proportional to the exposure. So if you have a lower X value, you have higher exposures. Okay, then we have the Carestream and the Kodak. So the exposure index is directly proportional to exposure. So anything exposure index is directly proportional to what? Exposure. Then we have the AGFA computed radiography. So they are log median, okay, logarithmic scale. Okay, a change of 0.3, doubling or half in of the exposure. So Siemens, digital radiography too is directly proportional to exposure. So target ranges depends on the exam type. So we also have the Canon, also known as a Rex value, and also vendor specific scales with target ranges, okay, set per exam. So clinical uses is all those radiographers, they check the EI after each exposure to confirm it falls within the recommended range. You understand? They always check it. So if usually shows low value, if it shows value, it shows that it's underexposed. Maybe the image is too noisy. Okay, and you might actually need to repeat the imaging. If it shows a high value, it shows that it was overexposed, and most of the times, you might need to still do the imaging. All right. So quality control is always to be ensured so that it's within range. It's within what is accepted.